views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Coming up on this edition of Perspectives, the COVID-19 pandemic has created some unprecedented challenges across the globe, including right here in the borough of the Bronx. With the COVID-19 vaccine now mostly available, we'll discuss the mistrust in the Black community regarding the vaccine and also provide some accurate information in helping people make their decision. The National Black Leadership Commission on Health, Black Health, joins us next. That plus a whole lot more on this edition of Perspectives with yours truly, Daren Jaime.
What's on your mind? Express what's on your mind. What's on your mind?
Anything relevant to life, you bring it to the table. Whether you make a move solo or a movement with a stable. No fables, just speak on your decisions. Cause in the long run, it's your voice, your views, your vision. Keeping it real with many messages for you to know. This ain't radio, but DJ runs the show. Entertainment, he rocks it. Politics, he locks it. The host with the most would handle any topic. Don't forget to share your perspective with shines of light. Cause it might make a difference in someone else's life.
Make a difference in someone's life. Express what's in your heart and your mind. Share your perspective.
And hello, everyone. Welcome to another edition of Perspectives. I am Daren Jaime. Of course, we thank you for joining us. As always, you can watch Perspectives every week here on BronxNet's Channel 67. And then we also encourage you to stay connected to us on our social media platforms at BronxNet TV. And then also my personal professional page for Facebook, Daren C. Jaime. And then also Instagram and Twitter, DC Jaime 23. There you can get some information as well as some inspiration as well. Well, coming up on the show, we go front and center with a very important topic. The COVID-19 pandemic has highlighted all the health disparities affecting Black Americans. Some studies show that Blacks were 3 times more likely to be hospitalized from COVID-19 compared to their white counterparts, and twice as likely to die from the virus. Now, the virus also showed that Black Americans are more likely to be uninsured and less likely to have access and utilize healthcare services. Join me right now to share a little bit more about this is someone who understands these statistics and is working very hard to change them. She was awarded a Citation of Merit during Women's History Month by the Bronx Borough President for her outstanding commitment to the community throughout the COVID-19 pandemic. She's the Chief Operating Officer at the National Black Leadership Commission on Health. Ms. Melissa Baker, we welcome you now to Perspectives, and good to have you.
Thank you. Thank you so much for having me. And I'm excited to be here to have this conversation because, as you mentioned, unfortunately, we are in unprecedented times. And so it's now more than ever, and being in the Bronx, this is a great conversation to be having.
Yeah, and I mean, I'll start where you left off. We talked about these are unprecedented times. They're unprecedented times. I don't think anybody predicted a pandemic would ever hit us. And then the fact that we're in this a year plus, when many people thought this might be a 3-month thing, maybe a 4-month thing. But honestly, now we're to the place where we're talking about vaccinations. We're talking about awareness. And so give us a little bit of a landscape as to where you see things being right now.
And it's interesting you say, when thinking back, you said we thought it was 3 months. It's been a year. And unfortunately, a year ago at this time in 2020, in April of 2020, I think we were all literally scared to death. Either we were experiencing on the news, people losing their livelihood, people dying from the COVID virus, and not knowing exactly what that looked like, and agreeing like we maybe had 3 to 6 months, maybe at the least. And now looking a year later and not only being fortunate enough to see the vaccine, but understanding that this is not something that's over so quickly. And with there being with the decrease in vaccines being seen across the country, we need to now be able to understand what is it that we can do to make sure our community has the information they need, but also the access to the vaccine.
So talk to me a little bit about the National Black Leadership Commission on Health and the work that you're doing right now. I know the Bronx is front and center, but also all across New York City and the state.
Yeah. And so organizationally, we were the National Black Leadership Commission on AIDS. And so for 30 plus years, the cornerstone of the organization was based on HIV. And probably 7 years ago, really started seeing the correlation between HIV and other health disparities. And we rebranded in 2019 to change to the National Black Leadership on Health, to really be able to focus on the health disparities that have been front and center now around COVID. And we took our HIV model, which is about community mobilization, working with community leaders to educate around whatever the health disparity is. And unfortunately, COVID is the health emergency that we were catapulted into. And so we've spent now a year just in the community. And when I say in the community, we're on corners, we're on the street corners, we're at the bus stops, we're at, now we're able to go into spaces. But in the height of the pandemic, we literally were outside talking to community members, identifying public housing spaces where we saw the COVID rates be very high, where we saw multi-generational families live, where we saw people, as you mentioned, how we were being impacted not only in Black communities, but other communities of color. And why was that? First of all, the way we live, the way we work. We are, what we know now is if we stop working, the country ceases to exist. We are the people that are providing services, whether it's the hospital or the grocery store. And so people were being impacted in that way.
Tell me a little bit about where we are right now, because obviously we're in the process of vaccinations. The United States is getting the vaccinations out. Joe Biden promising at least 100 million Americans will be vaccinated in the time to come. Numbers are continuing to rise, but yet and still, when we look at our communities, we still have heavy vaccine hesitancy. What are you hearing by way of hesitancy as to what are some of the reasons why people are just not taking the vaccine?
I think the hesitancy is more to do with information or lack thereof. What I say to people in organization as we're doing outreach, we're talking to people, our goal is to make sure you have the most accurate information. We want to make sure that people are not basing their decision to not take the vaccine based off of misinformation, based off of myths, memes from the internet, social media. We're saying to you, our goal is to put in your hands information that you need. And first of all, explain to people, immunizations have been around for a very long time. We no longer have, measles, mumps, chicken pox. Many of us, I'm African American, grew up in this country, born and raised family members. I have a scar on my arm that reflects my immunization. So our goal is to make sure people have the best information. And I think also people have gotten a little comfortable. They see things that are opening up. They see that the community, people are starting to go to restaurants. People are starting to move around a lot. And they feel like it's not necessarily no longer the issue that it really is. The death rate has dropped drastically. And it's our goal to make sure that people know that, one, the vaccine is something that will make a difference in whether or not you live or die. A lot of people say, oh, well, I had COVID and I survived COVID. But surviving COVID does not mean that you won't have repercussions later. We see long haulers, we see people having COVID and 3 months later finding other things happening to them. So our goal is to make sure that people have the best and most accurate information and not share misinformation.
Yeah. And when we talk about misinformation, a lot of misinformation has been out there in terms of the vaccination. We also know that there are some historical facts people have talked about in the African American community. The syphilis experiment and the Tuskegee experiment. But walk us through this here, because information is key, right? When we talk about the vaccination, there is a huge difference between the vaccination and what happened with Tuskegee.
Oh, absolutely. A huge difference. And I will stay in my lane knowing that I'm not a physician or a scientist, but have been in great spaces around this conversation. I'm fortunate to say that recently, he just stepped down as board member, Johnny Ford. Mayor Ford was 30 plus years the mayor of Tuskegee, Alabama. So we have a lot of personal connection as an organization to the city of Tuskegee, very aware and have been involved in a lot of the activities around acknowledging the Tuskegee experiment that was done to our community. And one thing, and it was actually recently released, an article from a lot of the Tuskegee community. They want us to be aware that we will never forget what happened in Tuskegee, but we have now become better informed. And so we cannot continue to allow historical trauma to be the reason we do not move forward healthy as a community. So when you talk about, understanding and recognizing that. And I think one of the things that we can do as a community is community leaders can take ownership and responsibility. So whether you're a faith leader, whether you are in a civic organization, whether you are what I call a gatekeeper, the strongest person in your own network, we all have a responsibility as leaders in our community to make sure that we are getting the best information so that when people bring up the Tuskegee Institute, you can reference and say, we know that exists. But we also know a lot of Black scientists are very, very involved in the vaccine, and they've done a lot to try to communicate that. And I will reference Greater Than COVID, Kamal Bell, and I will share that so that you can find it on our website. A lot of Black scientists are talking about how the vaccine was created. It wasn't something done that was done overnight, and that this is technology that has been in the making for a very long time. And scientific research does require you to kind of be ahead of the curve. And we were fortunate that they had been working on something for a long time prior to the pandemic hitting.
Yeah. I want to take a quick break, and coming up after the break, we're going to have an opportunity to talk about facts and myths. What are some of the facts concerning COVID-19? We'll debunk some of those myths coming up right after the break. Stay with us. We'll be right back in a few. Welcome back to the show. We are continuing our conversation, talking with Melissa Blaker, talking about the issue of COVID-19, letting us know exactly where we stand as far as a community with regards to COVID-19, vaccinations, information. The National Black Leadership Commission on Health is with us, and so we're great to have Melissa here sharing with us. And talk to us a little bit more about this, Melissa, as we really unpack a lot of stuff that we deal with is definitely based on some myths, and we're trying to do a good job making sure that there's some facts. So share with us what are some of the common myths that you hear, and give us the facts.
Yeah, and it always goes back to culture. And so as we talk about, Black communities and being cultural, a lot of people just immediately go to, they're trying to, kill Black people. They're trying to eliminate the Black community. That's why you saw so many rates going up among us. The side effects are worse than, that they're saying they are. And what we say to people, first of all, most of the medication, if we listen to commercials on television, I think we're all mortified when we hear some of the side effects. COVID is not specifically out to get Black community or communities of color. Our rates really are based off of many things because we do live in multi-generational homes. As I mentioned, how we work is important, but it's also these myths and misinformation reduces the number of people that are going to walk into the space and actually seek the vaccine. So a lot of the myths actually deter our community from going into getting the vaccination. And what we do know about the vaccine is that it actually reduces the impact COVID has. So a lot of people say, well, you have you get the vaccine and you still get COVID. Well, there's a difference in the level of COVID you get, and there's also a difference between life or death. So when we talk about, the flu shot and polio, a lot of those rabies shots, a lot of shots were created to reduce what the impact of the actual illness or virus may have on the person. So when we say facts, the fact is having a COVID vaccine will reduce the impact of COVID. You're less likely to die, like a very high, like it's 98% chance. So it's a very high chance. It also eliminates a lot of, hospitalizations and things like that. So I think those are the things that are important to know. And again, going back to the science behind the creation of the vaccine was not something a lot of people say, well, they just came up with this in 6 months. And I love our communities, but all of a sudden we've all become scientists. And we all know a lot more about science than we probably knew when we were in high school or wanted to know. So it's important that we understand that, science is constantly working. They're always looking for ways. And I actually recently saw one of the science shows on the National Geographic, and they referenced how the United States government is premier in the world. And they're always working to kind of come up with the worst case scenario way before it happens. So if you think about a smartwatch, years ago when we were kids, there was a show where this guy had a watch on his arm where he talked into it. Someone had already come up with those ideas way before the smartwatch hit our arm, 40 years later. So science is forever working, whether it is around disease or technology. They are trying to stay ahead of the curve, and we must be aware of that.
Yeah, I want to delve into the numbers a little bit and talk some of the numbers that we have here. It says nationwide Kaiser Family Foundation survey, 35% of Black Americans stated they definitely or probably will not get the vaccine. That was as of December 2020. But what numbers can you give us concerning what's happening here, transmission rates right here in the borough of the Bronx in New York City?
Yeah, and again, it goes back to those rates in those communities. And I pulled up the most recent data as of April 24th. So when you're looking in the Bronx at like the Claremont, Morrisania section, Belmont, Claremont, Kingsbridge, Allerton, Fordham, Baychester, Soundview, those areas not only have a high positive COVID rate, they also have, you see the death rates are higher. You have more people less likely to have been vaccinated. So when people say they're less likely to get the vaccine, what that means is, and there's a lot of infographics out there that shows you, for every person you come in contact with, and let's be clear, we must continue to be testing for testing for COVID. Because if you don't know if you have COVID, then you're only going to continue to transmit it. But for every person that comes in contact with COVID, they're replicating that by 3 people. So if every time you come in contact with someone in these communities, you're only going to spread it. And unfortunately, you are going to see deaths. People are still dying of COVID. A lot of young people are contracting COVID. The myth around the fact that if you're young, you don't get it. Well, a lot of our kids were actually home. Parents were not letting their kids out of the house. They weren't going to school. So it may not impact them to the same, but that does not keep them from actually contracting COVID, nor does it keep them from spreading COVID. So we need to be very clear that there are communities here in the Bronx that have high rates of COVID and low rates of vaccine. And those community, we need to challenge our community leaders and our community stakeholders, our faith leaders, to provide accurate information to their communities so that they are protected.
Are those the difference makers that you just mentioned? Community leaders, faith leaders, because I do know credible messengers do make a difference.
They make a huge difference. And I call gatekeepers, we have a lot of groups in this city, a lot. Most neighborhoods have, the male or, the lady on the corner that knows what's going on with everybody. I think those are gatekeepers. And those people,
that's what you're talking about?
Yeah, exactly. But they're very informed. And, if you think about, if you go into those neighborhoods, that's the person, the Miss So-and-so said, you need to go get vaccinated. And she's telling you why. As faith leaders, if you don't have the most accurate and up-to-date information, you have health ministries, assign someone to make sure they're keeping you up to date so that when you're doing your Zooms, you probably have access to more members now as faith leaders than you did before COVID, because everybody can come to the mosque or the temple or church now. But making sure that you're providing accurate information and ongoing, it is not a one conversation. These needs to be ongoing conversations. Civic leaders, your sororities, they're having meetings on a regular basis. And at the end of the day, in New York City, we have a lot of elected officials that are running for office. I've challenged community members to ask them, what are they doing about COVID? What do they know about COVID in the communities that they serve? A lot of these elected officials have stakeholders in the community that help them get elected. They go around getting petitions signed for them to get on ballots. Take advantage of those relationships. Know what's going on in your community. Go know what's going on in your community, but more importantly, make sure that your community has the most accurate information, because we are all responsible for each other.
We'll continue our conversation with Melissa Breaker after the break. She is the Chief Operating Officer at the National Black Leadership Commission on Health. Stay with us. We're going to take a quick break. Perspectives will continue in a moment. Back here on Perspectives, Daren Jaime here with you. Our guest is Melissa Baker. She is the Chief Operating Officer at the National Black Leadership Commission on Health, sharing with us a little bit about the work that's being done in making people aware of both vaccination as well as being tested for COVID-19. The pandemic, definitely something that none of us saw coming, but since it's hit, many people have had to have boots on the ground, really trying to pivot and get our communities right, and also the resources that they actually need. So Melissa, I'll share a little bit more because I know that there's this huge mobilization effort that you have in tech right now, really trying to make sure that people are armed with information, but not just armed with information, but being able to get to places where they can both get tested as well as getting vaccinated.
Yeah, no, it's really important. And I guess we should have actually started this at the beginning. One of the things that the city recently did was they made many of their vaccine sites walk-in sites. And the thought behind it was they're hoping that by removing a lot of the barriers which were put in place when they made a lot of the appointments only available through technology. So what you see is when you make everything available through technology, not everyone has access to internet, or the waits were long. So we have a list of locations where you literally can walk in and get vaccinated, and that's down to anyone 16 and over. Being clear though, if you are 16 years of age, if you have a child who's 16 years of age, they are only eligible for Pfizer. So even looking for that type of information, which we'll share and make available on the websites as well. So making sure that we know that you can walk in to get vaccinated. There are large hubs in every borough. There's a lot of faith-based organizations also that are providing vaccines. But more importantly, being mindful of health and hospitals have locations in the city, their mobile units, as well as health and hospitals, which is the public hospitals in the city. And some of their walk-in clinics provide COVID testing for free. And we want to be careful because we know, unfortunately, there's always people taking opportunities. But if you are to access a health and hospital location in the Bronx or in any of the boroughs, COVID vaccines are provided there, walk-in, as well as COVID testing, and they are free. Second thing is we've been doing a huge mobilization effort since COVID started, and that really required us to step outside of traditional outreach. Traditional outreach is usually social service organizations, but what we knew is we had to hit everyone. So we're doing outreach with small business owners, people who are entrepreneurs in their community who know everyone, whether it's a travel agency. We're working with youth programs because, of course, we need young people to be talking to young people. But what we also recognize is the community actually loves to see young people on the street talking and making a difference in their community. So they're more likely to engage with a young person who's talking about the need of being vaccinated or giving information. In addition to, of course, continuing to work with social services, people who are working with communities that are seniors, people who provide mental health services, looking at organizations that are traditional in HIV work, because what they do know is they know how to connect with people. But being sure that we do not work in silos, understanding that to actually do community mobilization, it requires you to go back to the same place every day over and over again. The community has to see themselves in you. And that's what's really important. Mobilization around the community means making sure, again, going back to your stakeholders, your Miss Jenkins in the neighborhood, again, putting the elected officials and faith members, faith leaders in those programs. That community mobilization literally right now means all hands on deck and all boots on the ground. And that's all ages. We cannot be so arrogant to think that there's a certain generation that can only make a difference. We need young people to be in this COVID conversation.
Yeah. And when you talk about the conversation, these are conversations that need to be had. And we need to get everybody to the table to be able to do it. What's been the biggest obstacle that you actually had to deal with in terms of getting get your mobilization effort?
I would say the mobilization wasn't the problem. I think the biggest obstacle when we first realized, once we got through the initial part of people just being traumatized by COVID, people
Right.
appreciated you being on the street handing out PPE. So you learned that people wanted to have a conversation with you. And they started to buy in what you were doing. as far as outreaching to them. I would say the biggest challenge is misinformation. The media is as great as they are for getting information out, they're horrible for all of the wrong reasons. They gaslight everything, and that becomes the talk in the community. And technology, there, you cannot fight this pandemic online. You cannot make scheduling and those things, resources only available online. We have to kind of go back to some of the old ways of doing things, because one thing you will learn from community mobilization, there's a community out there of people who have a residence, have a roof over their head, but they have no access to telephone and they have no access to internet. So they are literally waiting for the mail to arrive for information. And so how do you address that? And I think we as a country fail to realize only a percentage, and a very small percentage of Americans live in spaces where they have the check, the internet, the phone, the this, the that. And New York City is not necessarily any different. There's a lot of people in New York City who don't have access to internet or phone, but every day go home with a roof over their head.
Right. And I mean, internet before we thought it was as a luxury. Now we know the internet for all is pretty much a necessity. This pandemic has definitely shined a light on the digital divide and the work that needs to go on there. Before we go, for people who want to get in touch, how they can stay connected with you,
Yes.
You get the final word.
Yes. So before we go, we can be reached at www.nblch.org. And our phone number, we do check our messages every day. We're working remotely, but we have access to our messages, 212-614-0023. And my personal extension is extension 109. We can follow us on Facebook at National Black Health, as well as Instagram and Twitter.
Melissa, it's been great having you.
Thank you very much. I appreciate it.
All right. You make sure you come on back, and we'll definitely keep the people updated with information. Thanks a lot. Melissa Baker, who is the Chief Operating Officer of the National Black Leadership Commission on Health, our guest here on Perspectives. Thank you so much, Melissa, for being here. And listen, throughout the course of the show, what did we talk about? We talked about literally people being armed with information. In this day, information is power. The more information you have, the more power you have. You can make powerful decisions, or you can make a powerful, not so good decision. But many people are making powerful decisions and taking the choice in getting vaccinated. One thing's for certain, the virus does not discriminate, but when it does hit, it certainly hits communities of color harder than anybody else. And so, if you have the opportunity to get vaccinated, find out, get the information, make a decision. You might not just be saving your life, you might be saving somebody else's as well. And so, it's better to be on the side of right. And sometimes the right choice is doing the right thing. And in this case, considering getting a vaccine. So continue to get the vaccine. Also, COVID testing. It's still out there. If you're not sure, you can always get tested. It's free. And at the same time, it's also quite helpful. Daren Jaime here on Perspectives. That's my perspective. Listen, we invite you to share your perspective because you just don't know. It might make a difference in somebody else's life. So until next time we meet, take care. God bless. Stay safe.
Entertainment, he rocks it. Politics, he locks it. The host with the most would handle any topic.